Hello and good morning. My name is Jeffrey Fillingim, and today I am going to present a PowerPoint presentation on how to position a patient correctly for a PA and lateral chest radiograph examination. This is going to be a step-by-step process of safely positioning and imaging of the chest. So step one starts out with probably the most important step, which is to correctly identify the patient whose order corresponds to the accession number, the medical records number, the date of birth, or financial number. Each facility has varying identifiers for this step, so it is your job to make sure that you are correctly identifying the patient. And usually you want to do at least two forms of identification with the patient's wristband, which you can see right here. Step two, you want to get a brief but thorough history of the patient's complaints and their signs and symptoms. Examples may include having a wet productive cough for 2 weeks with no history of thoracic surgery. Those are important to help the radiologist understand maybe what pathology could be present. I included a short video just to let any users see exactly how to position a patient. So there is a short 3-minute video, and I've included the link here on the slide if you're curious. I also have an image of the right lung and the left lung, which is of primary importance. Both lungs are of primary importance when it comes to chest radiography. There are 3 lobes to the right, 1, 2, and 3, and 2 lobes to the left, here and here. And we have the trachea, which bifurcates here at the carina into the right and left mainstem bronchus. Step 3, you always want to explain the procedure to the patient to help ease any anxiety and to also help instruct the patient on what to expect. Position the patient for the actual specific projection. The radiographer must be aware of ideal versus complicated situations for the patient. This may affect how the radiographer positions for routine series. For instance, a patient may be unable to stand for a required projection, and that's going to play a role in whether the radiographer will have to order a portable examination or, for instance, a decubitus examination to check for air fluid levels. Breathing instructions are going to be very important. So each projection has specific breathing instructions, and that's specifically designed so the radiologist can determine if this is an acceptable. For instance, when the patient breathes in or inspires, the diaphragm actually goes down, whereas when the patient expires or exhales, the diaphragm goes up, which plays a factor in how much anatomy one can see. Also, step 6 is all about central ray coordinates. Where are you actually aiming those x-rays that are being created and emanating from the x-ray tube? Where are you actually aiming those? So for instance, on a PA chest, we want to be at what's called T7, which is the 7th cervical vertebrae. So that's important for one to know, which is approximately about 7 to 8 inches distal to the vertebral prominence, which is C7, not to be confused. So that's very important in order to not clip off any pertinent anatomy like the apices of the lungs or the costophrenic angles here and here. Then you want to be able to, for the next step, transition to step 7 here, which is to transition to the lateral projection. You obviously want to go check on the patient and make sure they're not dizzy or having any kind of syncopal episodes. If the patient is still in good condition, then proceed to positioning for the lateral chest x-ray, which will also be at T7, but now it will be aligned with the patient's mid-coronal plane instead of the mid-sagittal plane for the PA. And then the last 2 steps, step 8, is ensure the patient is still stable and comfortable while you check the images for thoroughness and accuracy. Again, the radiographer must have a comprehensive skill set of knowledge to determine if the radiographs are acceptable. And then lastly, step number 9, safely escort the patient back to their room or out of the facility if they are an outpatient. Do not discuss any results with the patient, as that is their physician's responsibility and out of our scope of practice. Thoroughly clean the examination room and prepare for the next patient.